So I'm Mariann Cleverley. I work for Neighbourhood Health Group as Director of Primary Care. I've been with the organisation for about 2 years, and that's part of the HealthETalks Group, who are part of the ICG medical family. My background is primarily primary care. So I've worked in primary care, don't like to admit this, for about 20 years. But obviously, I started very young, and run GP practices, walk-in services, out of hours, pharmacies, so quite a broad range. But I have to say primary care is my absolute passion, and really love working in different elements of primary care as well. So I've worked with little practices, big organisations, small organisations. I've also worked as PCN business manager, and I have to say, Captain PCN, big shout out to them because they're one of the best PCNs I've ever worked for, and Nikki Potts, the clinical director there, is amazing. So big shout out to all of those in Clapton, in Essex. So a lot of what we do at Neighbourhood Health Group is it's all about supporting primary care services and the people, because it can be a really isolating role. So really happy going out, meeting people, offering all the support that we can, whether that's helping with GMS contracts or with CQC mock inspections. It's really lovely to meet so many different practices all over the country and see all the fantastic work that's going on across in different places. And especially being able to do it with such a great group of people that we've got in Neighbourhood Health Group, such as Lorraine Gray.
Hi, I'm Lorraine Gray, and as Mariann says, I work with Mariann. I've been with HealthETalks Group for 6 years now. I was 2 years prior to that, I was doing consultancy with them, and then they convinced me to come over and work for them full time. They're a great company because the reason that I like working for them is that if you look at all the different aspects of the company, we're able to provide good care to every part of the patient journey, from primary care through to secondary care. My background is I'm a clinician by background. I did 25 years in acute care. My last clinical role was acute care matron, A&E, cardiac care, etc. And like Mariann, obviously, I started that when I was incredibly young. I moved then from acute care into primary care, well, primary urgent care, really. We were one of the first A&E departments to put a GP at the front end of A&E, and the company that provided that headhunted me into going to work for them. And we made a lot of changes working for them as well. We were one of the first ones to pilot 111 in its infancy, and all the news and media that came along with that. But that was exciting and really useful. I worked with Mariann with that company, and that's where we met. And we've been working together and friends for many years. I then convinced her to come over and work with HealthETalks Group, promised her that I would take her lots of different places, which I have through our mock CQC inspections. We've gone to Newcastle and Durham and Liverpool, all over the place, and she's absolutely loved it. We were in the car one day on the way back from being in Luton, our head office at the time, and Mariann and I were just talking in the car. It was one of those journeys waiting at Dartford Crossing where we were held in traffic, and we were talking about primary care. How can we help primary care? What could we do? Mariann had just delivered a webinar actually on funding streams, a free webinar that we put on about funding streams to support practice managers across the country. And we kind of touched on CQC around how stressful it can be when you're working in primary care to get ready for an inspection because it's so busy, and what could we do to support? And we both kind of said, why don't we help design some mock CQC inspection and then go out and deliver that and use our expertise to deliver that? And I think that's where it came from, Mariann, wasn't it?
Yeah, that's right. Yeah, it was that car journey. So for once, being stuck in traffic at Dartford was a really good thing. It gave us time to think about it. And I think that's the thing. It was great. So I was in practice manager at the time, and a PCN business manager. and some of the practices in my PCN had their CQC visits coming up. Obviously, it was just after the new quality statements have been released, and we're all like, "Oh, what? What do these mean? What do I have to do with these?" And know how stressful it was. Seeing those practice managers that I work with all the time, seeing the stress, the additional stress that they were under. And we know that there is no headspace at all in primary care to think about these things. Yes, you suddenly got to do it, but I think that's where it was sort of born from, the fact that we could see people struggling with no time to even know what to look at. And I think that's the thing, the inspections now are very different and cause so much more stress because it is very different. And lots of practices haven't had inspections since like 2016, like we were saying. And we really wanted to help with that and think of a way to do that. And that's really where Neighbourhood Health Group came from, was that wanting to be able to support practices and PMs and the whole team, because it's really challenging and stressful for everyone, isn't it, in a practice. So between us, with my operational background and Lorraine's nursing background, that's where the idea came from. Many other ideas have come since as well. So last May, Neighbourhood Health Group was born. And as Lorraine said, we have been all over the country. But, it's fantastic meeting all these different teams. And we get great ideas from every practice as well. And it's really important, I think, as well as being able to give the practice a real focus on where they need to look, actually concentrate on what you're doing well and shout about it. And I think, Lorraine, you feel exactly the same about that, don't you?
I think, and the brilliant thing about this is, because, as Mariann says, we go to so many different practices, and we've learned and we've grown as well by doing this. And there's nothing better than working with your best mate, kind of doing stuff as well. So that's a great thing as well. But we then look at things, we review how we're doing the inspections, we review the good practice from all across the country, and how often does that happen? It doesn't. We're so poor at shouting about what we do well, and we've been able to share that. And obviously, confidentially with other practices, we've said, have you thought about doing this? This would, simple little tweaks to how they deliver their care, really gets great results for the patients and for them as well. And they've got, just the simple things of putting a board in their waiting room about saying, "You said, we did," and you can see patients in the waiting rooms looking at it thinking, "Oh, we have got a voice, and we can improve care by sharing that great practice." And actually, it's the feedback we've had is amazing. We get reviews back from them, and we stay in touch. Our first practice that we did in Manchester, we're still in touch, and that's how we work. We say that we're not just walking around away once we've completed this. You've got our email details, just drop us an email, and we just carry on supporting. And it's great, and because we can apply that to the rest of the organisation, it's really useful. A large part of what we offer through Neighbourhood Health Group is a mock CQC inspection, and we've done several of those now. And the reason we came up with that was to help practices prepare and be ready for CQC, but not just to tick a box that they're ready for CQC, but also for them to help identify what they're doing well, what they need to put in place, but also how to keep their patients safe and make sure that their practice is being well led. So the CQC changed the way that they inspected last February. They now have 34 quality statements that you have to provide evidence that you are achieving those quality statements. And that can be a minefield. And when you first look at them, you think there's a lot of these are duplication, and actually some evidence will fit into more than one quality statement. But when you're working full time in a practice and you're really, really busy, how do you have the headspace to do that? It's not like there's a whole team of people that can actually start doing that. It's a small group of people that work in a GP practice, and they need to have the headspace to be able to take a look at what they're doing and find the evidence for it, because a lot of practices are already doing everything that they need to do. However, they haven't got the evidence in place to demonstrate that to the CQC and give themselves reassurance that they actually are doing that. So I think that's why we came up with this. And Mariann, I think the report that we've developed from that is now we've redeveloped it, and I think we've got it quite fine-tuned now, don't you think?
Yeah, I do. I really do. So the way the process starts is obviously you contact us if you're interested in working with us. We do a Teams meeting just to talk you through it in detail. But that's really nice to see faces and things as well, and to start talking and understanding what you need and a bit about us. Then we come and visit you. And as Lorraine has said, she's taken me all over the country. It's been fantastic. Not always, but we had a miserable journey back last week, but it's great. And you know, I love going and meeting new teams because I just think it's so exciting to see what people are doing, but also being able to contribute to sort of peace of mind, because I think that's what a lot of it is. It's that confidence in knowing where you are. We all know CQC will always find something, always. But it's not giving away anything easy, because most practices out there are doing such a fantastic job. It's just like Lorraine says, you've got to evidence that. So what we do, we get a bit of information from you beforehand. We do a bit of research like the CQC will do as well, online. Then we come and meet you and your teams. If you've got any particular areas you're worried about, we'll look at that. But we complete a report so that we can match all the evidence you have to each quality statement. And then we can recommend what you still need for any gaps to each quality statement. And that's, we give you by the end of the week. So we tend to try and visit on a beginning of the week. So by the end of the week, you get your priorities sent to you. Because I think for me, when I was a PM, one of the biggest things was knowing where to start and what's the most important. You know, it's obvious if it's something like safeguarding, but you're not always aware. So we say to you, these are your priorities. Start working on these now. And also quick wins, because you can get them checked off. Then following that, within about 2 weeks, you get a full report for each of the 34 quality statements with what evidence you've got and then what evidence you still need and suggestions how to capture that. Because like Lorraine said, that these quality statements take a long time to kind of get my head around them. And I know that they are talking about piloting a new general practice inspections. That'd be really interesting to see what that's like when it comes out. Hopefully it's a bit more user friendly, but we give you that and an action plan. So then you can go away, and if CQC, because we meet after that and talk through it with you if you've got any questions. And I think that one of the main things is if CQC suddenly then were to knock on your door and say, right, we're coming, you know where you're at. You can share that with them and say, yes, we know we've got some work to do, but we've got it all documented here. We're absolutely clear on what we're doing well, because that's really important, and shout about it, because they won't necessarily ask you that, but what we need to improve upon. And you'd have done the priorities, and that's a really big part of what CQC will look for. And if you've got that ready, and like Lorraine says, we have changed format and tried to make it, it's a live document. We're learning all the time as well, but we can share that good practice. But you do get a really clear action plan from at the end. And I think it just gives you peace of mind and your team as well to understand what the inspection will entail and where you're at with it. And I think that's really invaluable.
In our travels around visiting many GP practices, one key theme that we picked up on is that it's incredibly stressful. There's a lot of pressure, meeting your quality outcome framework, getting your funding streams in. It's a minefield, actually. And a lot of GPs have been in it for many years. And I think, you know, it's difficult for them to understand about how they can relieve that pressure, but continue delivering the care that they enjoy doing without the minefield of everything else that comes with the responsibility of having their name on a GMS contract. Another service that we deliver is to support with that. We can remove the GP off the GMS contract. We go on, we indemnify the GP, we support, they can stay on as a salaried GP, and we can have that whole support network wrapped around them so they can continue doing what they love without the stress and the anxiety of actually doing it. Isn't that right, Mariann? Is that kind of what we're feeling, isn't it?
I think that's bang on. So, I mean, I was still a practice manager this time last year, and like the way it says, travelling about as well, the stress is unbelievable. I mean, like we said earlier, I've been doing this a long time, and nothing ever seems to just settle. There's always something new. I think the issues really are at the moment is the risk. So that's financial risk is huge. I think it's bigger than it's ever been. We're still always uncertain about the future. So we're still waiting for contract changes to come out for next year, but we know we're not going to get the funding that we actually need to deliver this great care. And I think one of the great things about Neighbourhood Health Group and our leaders, if you like, of Neighbourhood Health Group is their understanding of that and wanting to invest to provide better outcomes. And that's something I've never had before. You know, we all really care about patient outcomes, but actually we're recognising that we need to invest in the infrastructure to be able to deliver better outcomes and bring new services in. Like, we know there's such a demand for ADHD at the moment on mental health services, and we also have those services available to us. We've got recruitment, so workforce is never an issue. And actually, one of my big things about workforce is nursing. I mean, we know that the sort of journey the GPs have been on recently, but nursing really worries me about the future of nursing. A lot of our experienced senior nurses are leaving. We can help with that. We've got that mentoring background. So we really are keen to invest to make things work. And I think it actually means you can enjoy the day job again. If we are there dealing with the risk and those stresses, you are involved as much as you want to be. Your team TP's over, so there's no worries about what happens to your team, because that's a really big part of it as well. I know there's a lot of worry out there as well. So if you're a single-handed GP or you were thinking about retirement, sometimes you're kind of stuck because you don't know what options are there, and you don't want to walk away and leave your patients and your staff without a job and without that care that you've taken all these years to build. So this is something that we think is really valuable, that we can provide that sustainability for your patients and your team, and for you for as long as you want it, because we'd love you to be involved. But likewise, if you want to walk away, you've had enough, we get that as well. And we'll work with you to find out what works best for you and your team. And we are communicate the whole way through. But I think it's really important knowing there are options there that you are happy with, and that make whatever decisions you need for your life and your work balance. We could be there to support that.
And I think we've seen several times, Mariann, haven't we, that practices have got overwhelmed by everything,
Yeah.
And then they get a CQC inspection that's inadequate or requires improvement, and then that's an even more stress for time and financial input to turn that round and get it back and then that causes increased ongoing anxiety. And as you say, around the nursing workforce, getting to an age where they're looking to go. So how do you replace that? What do you look at your skill mix? So we can support with that. We've got and looking from the outside, we can just be those arms that wrap around you to say, we're here to support you. We can do this. You can carry on, as Mariann says, or you can walk away with the comfort of knowing that everything is still in place.
And I think that's a really big part of it, knowing that you can leave it when the time's right for you and not worry about those things. Because like I said, you take years of your life. It's not a 9-to-5 job. We all know that. But the pressures now, just keeping up to date with all the changes is just sometimes just too much. And let alone doing the work, patient demands we know are growing, increasing. We used to have that time of the year, we talk about winter pressures. In the summer, we could all relax a little bit. That's gone. It's just pressures the whole time. Funding is less. And we don't want to lose what we've worked so hard to build over the years, but it's a different landscape now. And I think having the support of an organisation is really important, and really something you should be considering, because we can offer these things up alongside investment and that commitment to carrying on your good work.
HSGP has only been in place since it's less than a year, and we have been extremely busy. Several mock CQC inspections we've undertaken. And we've grown a whole network of people that are continuing contact with us now. And the exciting thing about it is that we feel like we're making a difference with these GP practices. They're continually sharing their action plans with us and how well they've done with them. And that feels really quite rewarding. And it's made them really, really confident about their up and coming CQC inspections and made a difference. So we're really excited about that, aren't we, Mariann?
We really are. It's just such a lovely feeling for everyone, I think. And if you would like to have that experience with us, then there's several ways you can get in touch and just ask us for more details. So you can email myself or Lorraine. And also we have our wonderful Emily who works with us as well, supporting and drop emails to us asking about that. Or just visit our website, which is nhgp.co.uk. And there's a form you can fill in there and just get in touch. And if it's not for you, that's fine, but we might be able to help in other ways. But it's lovely to make new relationships and help where we can. Well, hopefully we've been of some help to you all and made you a little bit aware about the type of things we can support with and the services we offer. But it'd be great to hear from you. Even if it's not something we've discussed today, please do get in touch. Either you can email myself or Lorraine or Emily, and those details will be on the screen, or visit our website, nhgp.co.uk, and hopefully we'll be in touch with lots of you soon. Thanks so much for your time.